love about treating the whole person instead of just having to treat symptoms?
I mean, every part of our body is part of an entire system, right? Like it's not like my shoulder exists as separate from the rest of my body. So by being able to treat the whole person, I can treat, all aspects that might contribute to my shoulder pain, right? Like, am I stressed during the day and shrugging my shoulders like this? I can ask those types of questions. I have time to be able to do some of that versus just being like, okay, let's only assess your shoulder and figure out like what is going on there without thinking about anything else.
Right. Like people's body parts just move in complete isolation. It's just not true.
Yeah.
Totally. Yeah, that for sure. And I also just honestly love the results that you get. Like when I started to shift that view from PT school, which was a little more isolationist, to really seeing how the whole body works together. One, it just made sense to me, but two, you got way better results that lasted and way more sustainable. Like using your example, sure, we can in a session make that shoulder feel really good, but if that person is then just hunching up because of other factors going on or stress or whatnot, then it's like, then they just come back and keep needing it, and they're just stuck in the cycle of constantly needing PT.
That's exactly, I think, hitting on that too, the education component, where when you're treating the whole person, you get to give them this information that's not just like, oh, don't move your shoulder like that, or just getting into the anatomy of it. You're really telling them like, oh, this is how the whole system works, and this is how you can live better, move better.
Yeah, I think that's just to say one more thing to that. I remember, I think when I was on one of my rotations in a hospital, it's like they literally would refer to patients like the knee, the hip, and it was like,
oh yeah, like you're identified by dysfunction.
Yeah, which it was surgical and things like that. And it's important to make sure we're aware what's going on. However, we need our knee to move well because we want to go bend down to pick up our kids and go up the stairs and have fun and squat.
That's what I was gonna say is like patients' goals are functional whole person goals. Yes. It's not like I would like my shoulder to have 150 range of motion in 2 weeks, right? Like their goal is like I want to be able to like get something out of the top cabinet of the house. Okay, that doesn't only impact the shoulder. Like that is a whole person goal. So like if you're really trying to meet your patient's goals and you're not treating them from a holistic standpoint, like you're really missing out.
Exactly,
for sure.
Totally.
That's awesome. I love it. So the next question is, what do you feel like is a common misconception about what PT can achieve for people? And I'll speak into this one a little bit before I let you guys answer, but I feel like this is the thing that I'm constantly almost having to hold back sometimes where I'm like, oh, PT can do that. Like, if you're like, oh, there's no help for me. You're just like, oh, I don't want to be annoying, but it's true. Like, we can do so many things. So what do you all feel like is something kind of specific to that?
Specific. Yeah, I'm the same way in that I think people do not understand how broad our spectrum really is of the whole profession. Doesn't mean each PT is going to have that full spectrum, but within peak physical therapy, I mean, truly it is whole body treatment. And I think one of the big misconceptions that I see people is they feel like they've plateaued on progress. And it's like, there is always something you can do if you are feeling restricted or if you are feeling unable to meet your goals or feeling like there's an area of life you're missing out on, whether it is just strengthening other things. Maybe there is something that we can't affect directly, but there's some indirect ways we can affect things. Often, even when people think, oh no, that my knee's just the way it is, pretty much it's usually not.
Almost never.
Yeah, almost never. But even in the case where it is, then it means there's other ways we can help you still move better and strengthen. Like muscles can always strengthen. And we can always support our bodies and move better and gain range of motion. And I think I think there is a misconception about this, like, oh, I've hit this plateau, there's nothing more I can do. So to me, anytime someone's saying that, it's like there's almost always something more that can.
Oh, for sure. And it goes back to the first question, the first question of like, usually then it's probably wherever you're treating is not the exact issue. Yes. Like you need to look a little bit, broader throughout the body of where the root cause of the restriction is coming from.
Totally.
Yeah, I would agree with that. I was thinking about people that have like older injuries and stuff. They're like, oh, well, it's been going on for a long time. There's no way it's getting better. But the other thing I was thinking about is like prevention. I think a lot of people don't realize that PTs do preventative stuff. Like I was at an event recently that runners were at, and somebody said, "Oh, well, I'm not injured yet, so I'll let you know, like, if I get injured." And I'm like, "Wait, why would you wait until you were injured to come see me? Like, you should come see me and learn some strategies to prevent injury. That way you don't need me because you get injured." And they were just like, "Oh, I didn't realize you did that." So I think like injury prevention is definitely something that we are experts in that people don't necessarily seek out. And also, it's not like our healthcare system like is great at prevention, but so in people's defense, it's not like we practice this often. But I think that's an area where people really like underestimate power PT.
Yeah. Well, that's what like is such a bummer is that a lot of times what's allowable through insurance becomes what people think healthcare can do. Just like what you said. Well, like people don't think that we can do prevention because insurance doesn't cover prevention. Yeah. So it's all of a sudden it's like, oh, well, the healthcare cannot do that for me, but it really can, and we're trained to do that, which is so cool. And that valuable piece that I think we all started PT kind of hoping for, and then realizing like, oh no, like, then you go to school and then you see how the system works and you're like, oh shoot, like I'm not gonna be able to do that. But then being able to work around into this and being able to do that again is really cool.
To add one more thing, I think also like performance optimization. Like we just did a workshop at a yoga place and the yoga studio, and it was just teaching people how to move within their class, what they were already doing, to just gain, 10 times more than they're going to get, which leads ultimately into the prevention piece, because it will prevent them from having injuries, but also just will optimize sport or whatever exercise you're already doing. If you're feeling like it's, maybe again plateaued off, or maybe it just isn't having the same effect. Often it's because our body has learned to just be super efficient with movements or move with certain patterns. PT can help to really feel into your body, what muscle groups are using, and just make any exercise you are doing so much more efficient and functional.
Yeah, I mean, that like I just had a patient this morning. That's exactly what we were talking about. Is that a lot of times your body will plateau if there's a compensatory pattern or compensation that they're using. Your body's kind of its safety net is to stop. Whether it's like running faster or lifting weights or whatever the activity is, like your body will have this natural like, I'm not going to let you progress past this point, because if I do, like the system's going to break down. And so there, the people come in, it's like, oh, I've been doing this, but I've never been able to go past like, a 25-pound dumbbell. Otherwise, it gets a little naggy. So I always go back. So they never consider themselves injured, or like, I'm sure with running, you hear people, it's like, well, but I've been running this like a 5K, but anytime I've tried to run a half marathon, it just doesn't feel good. Those are those natural body stoppers that I think, like you said, we are so good at finding, because we're essentially constantly watching people move. So we are the ones who can pick that out and help people progress in their lifestyle goals, not just like, oh, we don't want your elbow to hurt or your knee to hurt when you're walking upstairs. Yeah.